In this video, I'm gonna discuss about one of the most tested topic on Nclex, which is hypoglycemia. Most tested topic, and there is no way that you're not gonna get any question on hypoglycemia because they're gonna ask you so many questions on hypoglycemia, and you must know you cannot skip and you cannot take your Nclex exam without even knowing hypoglycemia. That is a must topic that you must know everything about it. So in this one, we're gonna go about hypoglycemia, right? So hypoglycemia, what is that meaning? The meaning is hypo means low, gly means sugar, and emia means blood. So that means low sugar level in the blood, right? That's called hypoglycemia. When you see any word regarding hypo, that's mean they are talking about low. When they are talking about hyper, that's mean high. Like let's say hypertension, that's mean blood pressure high. Hypotension, that's mean low blood pressure. Hypoglycemia, which means low sugar level, right? Hyperglycemia, which means the sugar level is high, sugar numbers are high. So you must know the definition of hypoglycemia versus hyperglycemia, right? Now let's discuss. So let's say you have to remember 15 minutes of rule. What is 15 minute of rule? So 15 minute of rule is that you are going to give 15 gram of carbohydrates and wait 15 minutes. So let's say if you are checking the patient sugar level, right? And if their sugar is less than 70, but the patient is alert and still can swallow anything. So in that situation, what are you gonna give? So in that situation, you're gonna give half cup of juice. It could be any juice like orange juice or apple juice. You can give that. You can give glucose tablets. You can give glucose gel if it's available. You can give hard candy. You can give honey syrup or honey. Or what else can you give? You can give low fat milk. You can give saltine or graham crackers. And now what you have to do, you have to wait 15 minutes. If the sugar goes up, that's a good thing. If sugar is still below 70, then you're gonna repeat same step again. You're gonna give out of this meals, you're gonna give something again second time, and you have to wait another 15 minutes. If the sugar go up, that's a good thing. If sugar is still below, then again third time you're gonna repeat same step. So, you got it? You have to repeat same step 3 times, and I hope after third time the sugar is already above 70. So that's called 15-minute rule. So you are gonna follow 3 times, right? You give, wait, give, wait, give, wait, and hopefully sugar will be up at this time. So that's called 15-minute rule. So now let's say if the patient is unconscious or cannot swallow anything by mouth, in that situation what are you gonna do? In that situation you have to bypass the oral thing because you cannot give anything by mouth, otherwise the patient is gonna have aspirate something. A patient gonna have aspiration, right? So you cannot, you have to bypass the oral thing, and you have to give. In that situation what are you gonna give if the patient is unconscious? So in that situation you have to give, if the patient has no IV access, the next thing you have to give, you have to give 1 milligram of IM glucagon shot in their deltoid. You're gonna give 1 milligram of IM glucagon shot. If the sugar is still below 70, then you can repeat IM glucagon shot on the next round. So hopefully the patient's sugar is gonna be up after second shot. One more thing I want to mention, when you're giving IM shot of glucagon, you can give either IM or sub-Q. There is 2 route available for IM glucagon shot, either IM or sub-Q. So let's say the patient has IV line. In that situation, what are you gonna do? So in that situation, what we're gonna do, we're gonna give them 25 to 50 ml of 50% dextrose injection. The dextrose injection comes, and then you're gonna give via IV push. I'm gonna show it to you on the screen how it's look like. Then you will push it. It's a thick glucose sugar water, thick. So you're gonna give via IV. So in your Nclex exam, if they're gonna give you option, the patient is unconscious and has a IV line, what is the best treatment? Then you're gonna choose 25 to 50 ml of 50% dextrose injection. That's your answer. If there is no IV access, if there is no IV equipment available, then you're gonna give 1 milligram of IM glucagon shot. That's the second step. Got it? So that's the treatment of hypoglycemia. But now let's discuss about sign and symptoms. What you're gonna do, see the sign and symptoms. So early sign and symptoms, there is a mnemonic call. He is tired. He mostly you have, if the patient has hypoglycemia, you will see the patient will have symptom of sweating, pallor, tremors, shakiness, or sweating. You will see these kind of symptoms. Also, there is a mnemonic called he is tired. He means represent headache. I for, as you can see, he is tired, the whole irritable, tachycardia, the patient heartbeat is going to be fast, irritable, restlessness. So those you will see on the patient early symptoms. If you did not treat, the patient could go to diabetic coma. The patient could go to diabetic coma. It is that severe if you did not treat their hypoglycemic thing. So I hope everything is clear for you how to treat patient with hypoglycemia. And I hope whenever you see question on Nclex, it's gonna be easy for you to get your answer correctly on hypoglycemia, right? And the last thing, let's say if the patient is in home, right, and they don't have any available, like there's no IV access there, no glucagon available, in that situation what they're gonna do, they're gonna seek the medical attention, they're gonna go to nearest to the hospital in that situation. So choose that answer when there is no equipment available, right? Good luck.